Okay, hi guys. I'm going to be talking about carcinoma of the esophagus. Um, okay, we're going to talk about the causes, the etiology, and patho. Um, the etiology, they're not really sure what causes this type of cancer, but there are a few links between genetics, smoking, and alcohol consumption. There's two types of this carcinoma. There's the squamous cell carcinoma, and then the risk factors for that are the alcohol and smoking. And then the adenocarcinoma, the major risk factor for it is GERD. The reason GERD is a risk factor is because it's essentially acid reflux, and that can break down the skin and put the patient more at risk to develop esophageal cancer. And for both types of the carcinoma, diet affects them. And then the patho is it's cancer that occurs in the esophagus. It begins in the cells that line the esophagus, and it is most common in men rather than women, and it's the sixth most common cause of cancer deaths. Okay, the clinical manifestations. This disease is pretty weird in the fact that there's not really any symptoms until the cancer has progressed significantly, but your patient may present with difficulty swallowing, weight loss, chest pain, pressure, or burning, worsening indigestion or heartburn, and coughing or hoarseness that persists. However, patients with Barrett's esophagus, which is it's a progression of GERD, they have routine yearly annual testing, depending on the severity of their Barrett's esophagus, just because it puts them at such a high risk to develop esophageal carcinoma. But normal people who are healthy, they typically do not have routine testing, so it's pretty hard to catch. The most common symptom for this is going to be progressive difficulty swallowing over 6 months. And also they may complain of they may complain of a substernal feeling, which is just a feeling that your food after you swallow is not pushing through and that it's kind of just sticking in the esophagus. And that's pretty common for patients with this disease. Okay, and then for the nursing assessment, you're going to assess the previous mentioned slide, like if they're having any of those symptoms, but you're also going to assess for any risk factors, such as if the patient has had GERD or currently has acid reflux, if the patient smokes, the patient's diet, and then you want to assess the patient's family history. If the patient has a family history of this disease, they'll probably be routinely tested by their primary care physician, but not always. So you want to make sure that there is no family history. If there is, you would probably need some further testing. And their past medical history, if they have GERD or Barrett's esophagus, or some chronic acid reflux or anything like that, that could put them at a higher risk. Okay, and then for diagnostic testing, you're going to do the barium swallow test, which is where they swallow a thick, chalky liquid that coats the inside of their esophagus as they swallow, and they monitor it with an x-ray. And I have a picture over here in the left-hand corner of what it looks like on the x-ray. And this can show any abnormal lumps or anything like that when the patient swallows, and this could help the doctor see if there is any tumors present. And then the CT scan and the MRI could show if the cancer has progressed to any surrounding organs, as well as the PET scan. And then they could do an endoscopy, which is what I have in the right-hand corner picture. And this is just a camera on a flexible tube with a light that lets the doctor visualize on a monitor what's going on the inside. And on my slide with the different types, it shows a picture of some cancer cells and tumors inside of the esophagus. And this can show the doctor any abnormal tissues. They can also take a biopsy at this time through the tube and send it for biopsy samples to the lab. And then you can have an endoscopic ultrasound, sorry, which could show if the lymph nodes surrounding the esophagus have been affected or if the cancer is metastasized to any surrounding lymph nodes. And then the bronchoscopy could show if, as well as the other two, beneath it could show if it's spread to any of those body cavities or into the lungs or anything like that. And then you'll have the blood test, which can show if any of the enzymes are elevated. That could show a positive result. Okay, in the medical management, you'll have surgery, which the most common surgery is esophagectomy, which is a removal of part of the esophagus that is affected by the tumor, and also the surrounding lymph nodes around it. And this is shown in a picture in the left-hand corner, and it can completely cure the cancer. It's usually treated in coordination with radiation or chemo, but it will take out that portion of the esophagus and a little portion of the stomach, and then the remaining esophagus is connected to the stomach. As you can see in that picture, it looks really weird. You'd monitor these patients for GI changes because their stomach is stretched out, so they're going to digest food a little bit differently. And then you could give them chemo and radiation. They're typically used in conjunction with each other. And then you can use targeted drug therapy or immunotherapy. You can use the immunotherapy if the surrounding lymph nodes were affected. Yep. Okay, and the nursing interventions. You would want to monitor the patient's respirations carefully. You would want to monitor their intake and output, and you would assess which foods the patient can and cannot swallow. Some patients may be put on a thickened liquid diet or a mechanical soft food diet because if they have a tumor blocking any part of their esophagus, they might not be able to swallow as normally. And then also this patient is diagnosed with cancer, so you would obviously provide some support to the patient and to their families because it's not easy to go through. And we learned about what kind of support you can provide in our oncology unit. Okay, and for patient teaching, you would want to teach the patient to follow the diet that the provider has ordered. So when they go home, you want to make sure that they understand what diet it is, what they can and cannot eat, how to prepare their food. You would also want to make sure that they administer their pain medications as they're ordered, teach the patient a schedule and tell them the risks of taking too much or not on time. You would want to teach them deep breathing exercises if they have had the cancer removal. You would want to teach them the smoking cessation because that is put them at higher risk of returning cancer. You would want to teach them good oral care and infection control if they have had any type of chemo because they have a weakened immune system, so they might be more susceptible to infections. Okay. And then the prognosis. Okay, by the time the symptoms appear of this disease, it's often well advanced because, like I said previously, it doesn't typically show signs and symptoms. The high mortality rate with this cancer is affected by the patient's age, if there's any tumor evasion to surrounding organs or tissues, and then if there's any metastases to the surrounding lymph nodes. This is because the esophagus has an excessive lymphatic network, which could facilitate the rapid progression and spread of these malignant cells to the other organs, locally or distant. And also, the stage of the cancer is going to directly affect the survival rate. So people with routine screening, they might catch it a little earlier, so their prognosis might be better. However, people in the late stages, when they catch this cancer, it might be too late. So the doctor may order palliative care for this patient. And if it's metastasized, it's usually a bad sign in this cancer because it's probably well progressed. Okay, I think that's all I have. Thank you.